Hi, and welcome to our Eyewitness News Town Hall discussion on mental health. Our parent company, Sinclair Broadcast Group, is partnering with the National Alliance on Mental Health, NAMI, to launch Sinclair Cares, Mental Health, Support, and Hope.
It's a campaign to encourage mental health awareness with a focus on young adults. NAMI is the nation's largest grassroots mental health organization dedicated to building better lives for millions of Americans affected by mental illness through advocacy, education, support, and public awareness.
Here's Dave Benton with more on what that organization does.
The National Alliance on Mental Illness is the nation's largest mental health organization, connecting people with resources like counseling, therapy, and education, all helpful tools for those who didn't even realize they're suffering. 1 in 5 U.S. adults experience mental illness each year. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year. Suicide is the second leading cause of death among people aged 10 to 14. So NAMI, Greater Wheeling, is the gateway for mental health services across the state of West Virginia and 4 counties in Ohio, Jefferson, Monroe, Harrison, and Belmont.
So a lot of times we'll get calls from individuals who just don't know where to start. They know that they need help, but they're not sure where to go, and so we can help navigate the system for them.
NAMI also offers support groups for adults in person or virtually. These are good for those who struggle or even family members.
So a lot of times family members are the ones who are supporting individuals who have lived experience, and they themselves sort of need some support in terms of focusing on their self-care. So we also offer a virtual family support group.
You don't have to have a diagnosed mental disorder to attend. Everyone struggles one day or another. It's when the bad days turn into bad weeks or months to start making a call.
We all have mental health. And it's really important that we focus on our mental health just like we focus on our physical health. And if somebody maybe is experiencing a change in their mental health where it's impacting their ability to be who they typically are, we don't want it to get worse.
And if financial cost is a burden, there is still hope.
Many mental health providers offer sort of a sliding fee scale or assistance for individuals who maybe don't have insurance to cover mental health services.
It's important to use services like 988 Suicide Hotline and our Sinclair Cares or code to link you straight to the resources you need.
Thanks, Dave. Throughout this town hall, you'll see a QR code that will be along the bottom of your screen. You can open up your camera and click on that link. It'll give you access for ways to identify a problem early and get the best possible solution. You can also find a local NAMI chapter near you. You can also find out about other resources and support groups in your area at sinclaircares.com. Jennifer McAndrews joins us now to talk about programs in our state and how to help young people navigate tough times.
And now as we open up the discussion on mental health issues, our special guests here today have some insight on that. And I'd like to welcome Christina Mullins, the Deputy Secretary of Mental Health and Substance Use Disorders with the West Virginia Department of Health and Human Resources. Christina, thanks for coming by. And also Kim Pack, the Director of Children's Services with FMRS Health Systems, serving Fayette, Monroe, Raleigh, and Summers County. Thanks so much for being with us too, Kim. We're glad to have you both here. There's so much to talk about with this, and as we look at where we start, possibly some numbers too. How many people do we serve, and who's getting served right now? Is it growing for the number of people looking for mental health services?
I certainly think it's growing, especially after the pandemic. I think we saw 36% of kids prior to the pandemic experiencing feelings of sadness. And after the pandemic, that rose to 44% or so. So we know that kids are really experiencing increased mental health needs.
They are. Kim, too, with that, you have many programs that you work with that help children and families, too. Mm-hmm. One of those is called Wraparound, right?
Yes. Yeah, the Children's Wraparound Initiative. The Children's Wraparound is an intensive strength-based program for families whose children are at risk of out-of-home placement for something like their serious mental illness. It could be abuse and neglect. It could also be just parents not really sure and needing extra support to to provide what the child needs in the home to remain in the home. So it's strength-based, it's family-driven, nothing about the family without the family present, and the family actually creates their own family vision. What do they want? How do they view their family? What are their goals for the family? And so the family's really the expert in this, and this brings a team of people together who share one plan of care. So you may have in-home therapy or in-home respite or out-of-home respite services available for the family. It could be youth peer support, and this wraparound facilitator acts as the hub that brings all of these services to the family. And we're also including a real important part of this is the community that the child lives within. It's important for them to feel a part of their community. So what resources are available? Is there a local high school coach that could provide some mentoring services, or a local church group that might help a young person buy a saxophone so that they could join in the band like they wish to do? And so it's very family driven, it's very strength based. We're not looking so much about what's wrong with everybody, but what has happened and how might we heal some of those things to make it possible for them to stay together. Because children taking out of the home is not ideal at all. We want to keep families together in West Virginia.
And Christina, crisis services all around have grown, right?
Yes, crisis services have dramatically expanded over the last several years. We're really trying to build out a good crisis continuum, and it starts with 988, a simple number to remember. Just like we have 911 for other emergencies, we have 988 for mental health emergencies, but we also have a non-emergency number that can be accessed through 844 Help for WV, where you can access all of the same resources that you can through 988, but is a way to access mobile crisis services, wraparound services that Kim talked about. All of these different services are available and accessible there. And we want someone to be able to respond, so we have mobile crisis. And sometimes, though we want to avoid it if at all possible, that people might need acute care services in an inpatient setting. But our goal, as Kim mentioned, is keep families together and have them served through their home and community-based services. That's our top goal. And these programs are designed to keep children and families together at home.
And with those kind of programs, Kim, I want to go back to the wraparound too. It's so interesting what you've had to put together and work with there. You mentioned going to different lengths to help the children maybe learn an instrument or maybe get in touch with one of the coaches or something. How does that inside help the child?
Well, when we think about many times the behaviors I think that we're seeing are a language that they're speaking to us. You know, we need to understand underlying needs that may be unmet, and also just the opportunity to be involved in their community. Many times families are so very busy surviving that they're not able to thrive. And so that young person in their household may miss out on opportunities simply because the family is very busy paying their bills and getting things accomplished. And so, you know, the teenage years and the late childhood, early adolescence are such an important time for peer activities. So we want to make sure that the family is functioning in a way that not only at home but at school and in the community. And
so it sounds like wraparound makes you well-rounded.
Yes, we definitely peek in all the corners and figure out what can we bring to bear to support this family and keep them together.
And one other interesting aspect of the services that go on now, you said you work with a mobile unit too. How is that?
Yes, we have a mobile crisis unit, mobile crisis response team for children in our area and across the state. This exists across the state, both wraparound and mobile crisis exists in all 6 regions of our behavioral health centers. And so So mobile crisis is 24/7, 365 days a year, available. Call somebody on the telephone and have a mobile response team at your location within an hour to help you calm the situation. And then once the situation has been calmed, we can then turn our focus to, shoo, that was scary, but we're all doing well now. So let's create a plan where should something like this happen again, we'll have some strategies that we could try.
Where would you go?
Well, our very first call, when we started, we piloted in 2017, and honestly, we brought this from New Jersey and Connecticut. It was important to us to do this right, so we followed implementation in other states that have worked. And we were, I will admit, sitting around thinking, is anyone really going to call us? You know, are they going to call us when their child is having a problem? And they will. So our first call was actually to the Walmart in Beckley. We have responded to Gabe's. We've been to public libraries. We've been into countless homes, schools. Isn't it great if you have like say you have a children's wraparound for your family and they get that support and creative brainstorming opportunity there to connect with not just professionals but natural supports, then that can go into the school system where here we have this plan of care. How might this be adapted to help support the child in school? And then the same for a mobile crisis response in the community. So no matter where the family is, there's services available to help them.
When you're going mobile like that, is there a certain number of people you have with you or certain people within your group that you call depending on the situation?
No, we have a mobile crisis response team.
Okay.
And so we, in our particular region, we have 4 or 5 responders, and they take shifts overnight on call, and so they go wherever is needed, whenever is needed. Mm-hmm. So they get specialized training to help them understand how to help families calm situations and then work towards stability and what support they might need.
Christina, are there different groups like Kim's all throughout the state?
Yes, we're broken up into 6 behavioral health regions, so we have providers in each of the 6 regions who are familiar with those communities and are available 24 hours a day, 7 days a week. It's our goal to respond within 1 hour, but sometimes if you're a little more remote, it might take us a little bit longer, but we'll stay on the phone with you until we can get out there to you and help de-escalate some of those things before the mobile crisis team gets on site.
And it's got to be so helpful for the people on that team to know the area and just to get there quickly and know where to go when they're called someplace like a department store or someplace like that.
It's critical, and they have to know the resources within the community. You have to be able to navigate and get around, but you have to know the resources and what's available, because if you don't know what's inside that community, it's much more difficult to help.
All right. Are there some barriers, too, at this point to overcome for getting help for the younger population?
Transportation, of course, is always a barrier, but I think that right now, this is my soapbox, but workforce is a barrier. We need more people who are trained and available to help us do this work so we can expand these services even more. We only have about 13% of the workforce that we need to be able to do this work. So workforce is huge, and it's my number one concern these days.
Mm-hmm. Where do you go to look for, do you recruit for your workforce that you need, or are there colleges around that help train?
So the universities and colleges do produce workforce. We have to be able to retain them here in West Virginia, so we're working on loan repayment programs to help with that. Training and support is also critical. You want them to feel like they know how to do their job when they get there and to be comfortable doing their job and not stressed out. Mm-hmm. And then we're also want to be able to work on those reimbursements too so that we can get pay up. That's also a critical piece of the puzzle.
All right. Ladies, thanks so much for your insight on that. And we certainly have more to go over, and we'll come back in just a little while and do that. In the meantime, we're going to send it over now to Anthony Kahn with more.
All right, thanks, Jennifer. And you heard how our panelists talked about programs available in West Virginia that focus on children and younger people. Hannah Klein had the opportunity to see firsthand how the Children's Mobile Crisis Response and Stabilization Team responds to these situations.
We've had calls where it is, my child is wanting to kill themselves, or they're cutting.
Most days, Raquel Munoz and Caitlin Smith-Zimmerman are heading to de-escalate a family crisis involving children.
I found them with a razor, or sometimes it's just they got into a fight at school.
It's an on-demand job. They go when called. This team is headed by Prestera, a behavioral health services provider that covers a 10-county area. Prestera's CEO says depression and anxiety among youth skyrocketed during the pandemic, leading to an increase in calls to their Children's Mobile Crisis Response and Stabilization Teams, a service Prestera began rolling out in 2019.
You can imagine what that would be like from their perspective if they're at home that whole time dealing with whatever was going at home. So they're going to survive the best way they can.
A study from the Centers for Disease Control and Prevention shows more than 55% of the kids who took part in a survey reported experiencing emotional abuse by a parent or other adult in the home.
It could be anything.
This includes swearing, insulting, or putting them down. Munoz says the number of calls also vary from day to day. Sometimes they may get one, while other days they could get 8 calls.
Staffing is an issue. So it's very difficult if I don't have enough staff and somebody calls that's very far away.
Health experts say the pandemic brought with it long-term mental health damage for kids and families across the nation. However, these mobile teams remind children and families that it's okay to not feel okay, and that help is there when it's needed.
It takes a community to raise families and healthy families. It's not one or two people, it's all of us. And I think that's what we need to realize.
And these teams hit the road as part of that community. In Huntington, Hannah Klein, Eyewitness News.
And to contact the Children's Mobile Crisis Team, you can call 1-800-642-3434. We have that number for you right there on our screen. They're available 24 hours, 7 days a week.
And I'd like to welcome back in our panel today, Christina Mullins and Kim Pack, as we continue our discussion now on mental health. And we've gone over a lot of information for dealing with the younger population, the kids with mental health issues. And Kim, one thing that we want to touch on is their behavior and how that could be a little window into how they're feeling, what they're experiencing, and unlock some clues to get some help. Is that how it works?
Yeah, if you think about it, our little kiddos, they don't have the language, the cognitive development or language development, to truly explain how they feel. They may not even understand how they feel or why they feel certain ways. And a good measurement typically is, let's look at the behaviors that you're seeing and what is the function behind those behaviors. So like a couple examples are a child who has lost family members to traumatic overdoses or traumatic separations, losing parents to incarceration or, family members and things like that. That child may be less likely to trust other adults. And so they'll behave in a way that prevents closeness and prevents a relationship. For them, closeness may equal pain or hurt. And so if you understand the function behind that behavior, you're much more able to meet the need, the underlying need around. Another example is an aggressive bully in the courtyard, and they're biting or kicking or hitting other children in the school, and that's difficult to maintain in a school. And yet, if your first go-to is punishment versus understanding what might be underlying that behavior, and in chaotic, toxic environments at times, the biggest, baddest person in the room is the safest, if you think about it that way. And so those those children learn to react to unexpected circumstances more aggressively. But our brains are incredibly plastic. Susie.
Yeah, so in some cases, would they even know that they're behaving that way? Is it automatic?
They don't understand the why. A lot of these are unconscious responses that we have in our fight or flight system that is meant to help keep us safe. And sometimes if they experience a lot of adverse childhood experiences, that gets a little triggered on more quickly and more often than maybe it needs to be. So they need to meet with understanding and forming relationships so that we can help them learn to trust themselves and trust their ability to get their needs met in other ways.
I wondered how things like this escalate through the ages for them then too, once they get into their older years.
Yeah, well, just think you have a 6-year-old with post-traumatic stress disorder untreated, and then he will eventually be a 13 and a 15-year-old young man in our system. And so it's so important that we create a service array around our children and families to help them stay together and find the creative ways to meet needs so that children and their families are safe and healthy and happy.
Christine, at that point too, I guess maybe thinking about improving access to this type of care too, especially for more serious cases, right?
Yeah, we're really working on that. In 2022, the legislature actually passed a bill authorizing DHHR to pursue implementation of certified community behavioral health clinics. And what that means for West Virginia is that we're going to be working to improve quality. We're going to be working in communities to make sure that the array of services that we're talking about, high quality services for children and adults, trauma-informed, but that communities have similar access to care, high quality care throughout West Virginia. And with that, remember I talked earlier about workforce shortages and that we need to be able to increase reimbursements and payments. If a clinic is able to achieve that certification and demonstrate that they're providing high quality care to their patients, then they'll be eligible for an increased reimbursement rate, which will really dramatically, I think, help improve the infrastructure of mental health care across the state. This is an incredibly important project. The department was one of 15 states recently awarded a grant from SAMHSA that will make us eligible to apply for another to be a demonstration site, which will also allow us to get more money from the federal government if we are successful in applying to be the demonstration site, so that we can better implement this and make more resources available to West Virginia. This criteria, though, for certification is so important because we really want centers to demonstrate that they can provide 24-hour access to care, that they've got mobile crisis services, that they've got wraparound, all of those services for kids. They'll have services for adults too, but we want to really make sure that we're shoring up the children's mental health services, and this will be another tool in our pocket to help really improve quality of care. And that's going to be the emphasis is on the quality and everybody having that same baseline of core services, and then improving the overall quality. So I'm really excited about that project moving forward.
So I hear a lot of community-based. That seems to work so well. Does this go in conjunction with maybe what schools can provide, or is this kind of standalone?
This will be, so many of our comprehensive centers already offer services in schooles through an expanded school mental health project, which maybe we can talk about soon.
Yes.
But at the it's about partnerships, and it's about continuing working with the communities, but also, I mean, as going back to wraparound, sometimes it's not about therapy or what you're offering in the office. It's about what's available in the community too.
And the wraparound project and method service, what we can call it there, seems so important because it is touching on so many different areas, Kim.
Yeah, homeschool and community. That's our focus. What can we do at home? What can families do in the community? And what kind of support and services can we provide in the school system as well? So having one plan of care for all the different systems is, I mean, just think of a family in jeopardy or very busy surviving. They're going to have a therapist. They're going to have all of these people in their lives, and that sometimes that's a little overwhelming, and so having a facilitator that can sort of help wrangle those services, help the family identify some natural supports, can be very effective for everyone involved with the child to know how to plan.
And it's really a big web that can help.
Yes.
It sounds like.
It is a very big web. We want it to be a big web, a versatile web.
Yeah, and it seems like it's had to grow that way, and it's a good thing those services are there.
Yes, it is. And then we've started small. As Kim alluded to earlier, we started with pilot projects. We demonstrated that they worked. We expanded. We were able to make the case that we needed additional funds for those projects, and we just kept building on those successes until we achieved statewide services for many of these projects, which when I first started in 2018 working on specifically behavioral health, these projects were all pilots. So this is a dramatic expansion in a short period of time.
One thing people maybe would like to take note of too is how to get in contact if there is a crisis happening, and the state has a couple of easy methods, right?
We have several easy methods. The most easiest is 988. Just like we call 911 for other emergencies, you can call 988 for a mental health emergency or a mental health crisis. Also, our non-emergency line is 844-HELP-for-WV, and you can access all of the services we've been talking about, whichever number you choose to call.
Wonderful. All right, I know we still have more to talk about. We'll get to that shortly, but right now we have more right now with Anthony.
All right, thanks, Jennifer. And neighboring states to West Virginia have passed or are looking at legislation to give students excused days to help whenever they're having an off day. In Kentucky, 2 students helped write legislation making a student mental health day an excused absence. Governor Andy Beshear signed it into law last year. This law allows public schools to provide students with up to 10 excused absences for reasons involving their mental health or behavior. The Kentucky Department of Education has left it up to each individual school district as to whether or not they choose to implement the Student Mental Health Day. In Kentucky, 2 students have helped write legislation making a Student Mental Health Day that excused absence. Right now, lawmakers in Ohio are looking to add a similar bill. Theirs would allow 3 mental health days for students. They could use them either there or at home. Now, Ohio House Bill 38 was introduced by William Blackshear to help create a space for students to talk about their mental health needs. But educators do worry, though, that school districts won't have the funding to support them if that bill is passed. However, the bill states that it would give school districts resources like counseling and psychological services.
I think, especially for young kids, mental health has been kind of pushed to the rear a lot of times. We think about things like discipline and motivation and responsibility. We don't think about things like anxiety and depression and loneliness.
And we'll continue to follow this and let you know if and when that moves forward. And like we mentioned earlier, 1 in 6 U.S. kids aged 6 to 17 experience a mental health disorder each year. And half of all mental health conditions begin by age 14. I spoke with a high school counselor about what they're seeing and hearing right now in their schools. Students are facing a unique time, now in their 4th school year since the beginning of the pandemic.
I think it's like opened up the curtain to this heightened awareness of mental health, where we are more engaged with it, staff and students alike.
Kanawha County Schools lead high school counselor Richard Tench sees about 200 students while working at St. Albans High School. He says some kids are dealing with uneasy feelings and tough situations.
Anxiety is a huge one, and I think it's just the stress of life. life, compounded with everything else and the pressures that are going on, keeping up with school, trying to perform their best and adjusting to everything. Stress has really been a huge one.
According to NAMI, 18,000 West Virginians ages 12 through 17 have depression, and 55% didn't receive care for it last year. In Ohio, 113,000 students in that age range have been diagnosed, and 51% aren't receiving care. While in Kentucky, 40,000 kids in that group have depression, with 35% not being addressed. Ted says Kanawha County school staff trains every year to be as preventative as possible when it comes to depression and suicidal thoughts.
I think students have been more open to talk about mental health and what's going on with them. So although some of those conversations unfortunately do happen, we're having those conversations, those tough conversations with parents that your student just came in and disclosed the following to us. Never easy conversations, but I wouldn't say they're on the rise.
No matter what class they're sitting in or what grades they're getting, Kanawha County school staff want their students to know that whatever they're going through, they have someone to talk to.
Just talking some things out, though, can be very beneficial for students because sometimes they're experiencing these things for the first time. And when you experience these new experiences, they don't have the skills, the knowledge to really be able to navigate that themselves. So just building those relationships is key as well. Just having those relationships and understanding there's always someone in your corner, it goes a long way.
And as we continue with our town hall, Sinclair Broadcast Group is partnering with the National Alliance on Mental Illness, or NAMI, to launch Sinclair Cares, Mental Health, Hope, and Support. You can learn more about resources and support groups in the area at sinclaircares.com or by scanning the QR code on your screen. Let's check back in with Jennifer and our panel about what else is available for young people.
Thanks, Anthony. And we're back with Kim Pack from FMRS Health Systems, Director of Children's Services, and also Christina Mullins, the Deputy Secretary of Mental Health and Substance Abuse Disorders with the West Virginia DHHR. And thanks so much for being with us today. We've covered a lot of information about services there for kids and also families, and kids of all ages too, really. And we want to talk now about the importance of trauma-informed care. Kim, how does this work?
Well, trauma-informed care is a way of interacting with families and children that takes into account the experiences that they have had in their lifetime. For example, we will often have an intake at work. So we're bringing a child in for treatment and therapy, and we're asking a lot of questions about, depressive symptoms, other kind of symptoms. But sometimes, so at the end of that intake, we may understand that, okay, we have a 13-year-old who is using marijuana and alcohol, is truant at school and facing an incorrigible charge. And so that's who we meet, right? But by forming a relationship through a trauma-informed lens and understanding what we were talking about before, that behaviors frequently are telling us about underlying needs. Once we do that, then we can understand that this child was born exposed to opiates at birth, that they have seen their sister overdose in their lifetime. They have been unable to, because of poverty and various things, connect to their community in a positive way. And so if you understand those things about that child's experience, the behaviors that you see make a lot more sense and gives you a direction to go. So trauma-informed is basically a lens that through which you look at families and sort of conceptualize what they have been through. And that extends not just to children, but to their caretakers. What kind of experiences have they been through? How were they raised? In what way were they supported as children? Where were areas? And so that doesn't end just because you become a parent, and so we need to meet families where they are in the community, in the school, where in their home, and truly where they are emotionally as well, and understand through things like the language that you choose. Is this child manipulative, or is this child seeking connection? Is this child aggressive, or is this child fearful? And so it change is how you view families, and that helps you serve them in a way that is non-stigmatizing and supportive. Because we all make mistakes. Things happen, and as long as we have breath, we have hope that things can get better. But they need to meet a trauma-informed person in order to open up
and find those nuances
and find those things that can be helped.
Christine, at this point too, I know another path would be prevention and early intervention services too. Where do things stand on that now in the state?
Well, I'm really excited to talk about expanded school mental health. We started out with 12 schools in 2015, and we're up to 93 schools now. Expanded school mental health is so powerful because it starts at the front door. It starts at the community. It starts with the school environment. It starts with how a child is graded. It starts in the classroom. How is it set up? How is it designed? And so community mental health centers work with the schools to say, how can we establish this as an environment so all children benefit from expanded school mental health in that school, not just the child who might be showing a behavior. So the idea is to prevent those behaviors from getting started. But sometimes a child encounters an issue. So we have that behavioral specialist that's there and available for that teacher and that classroom and those administrators to say, this student, not too bad, but we're seeing some things. And so they can have a meeting. They can talk about what's going on with that child, develop a behavioral plan, and maybe put that fire out before it ever got started. Work with the family and say, okay, things are resolved, business as usual. But then you get those kids that just simply need more, right? They're struggling. They might have issues at home that we're not privy to. But because we are partnered with that community mental health center so closely, we can offer those therapeutic services right there at school. So they don't have to miss school to go out for an appointment. We can just, with the permission of the families, pull them out, do the therapy right there. We can do it via telehealth if we need to. If it's in a rural area, we can do it on site. We can integrate it right there into the school so that it's seamless, and it all becomes part of that partnership with the school so that there's feedback with the teachers, there's feedback to the classroom so that we can make that a better environment for everybody. And it's just a tremendous program. And I'm so proud of the work that those schools are doing.
It sounds like that also takes another layer away from the teacher having to deal with that just on their own as well.
Yes, it is very supportive of the teacher, and teachers have a lot to deal with. Their responsibilities of teaching the children, managing the behaviors, doing their lesson plans, all of the things that they have going on. So this is not just a layer of support for the students. It is support for the faculty and administration.
I can't help but think a teacher in the classroom would be processing all of that, even if they knew how to handle that situation. They're doing one thing over here, trying to do that on the other side too. Yes. So this has got to be an amazing help for all these schools taking part.
Oh yes, and we know that they are more likely to be on track academically. The schools that have expanded school mental health, the graduation rates are higher if they have the program. So it not only impacts just the behaviors in the classroom environment, it impacts educational outcomes, which we know is also very, very important.
Is there a movement to go to more schools?
We are always trying and seeking to identify ways to expand. Funding can be a little bit of a challenge because we do have a lot of schools in the state, and also workforce and resources. But we're constantly pounding the pavement trying to expand this program. We want every school to be able to have it eventually.
Sounds like a great system in place.
Absolutely.
All right. And Kim, too, one other avenue to look at, too, non-stigmatized strength-based engagement, too. How does this work?
That is an example of a trauma-informed approach in that, we all have experiences, positive and negative, and those come together with our genetics and everything else to create who we are, who you see before you. And so it's important that when people are reaching out, we have a culture here in West Virginia, and sometimes mental health issues can be stigmatizing. And so people are less likely to reach out for services or for help. And so by creating a trauma-informed environment, and where we're very careful about the words that we choose, like connection seeking versus attention seeking, or manipulation is getting your needs met. Those are examples of that. Or using a mental health issue versus she's crazy, or it's very important that we choose our words carefully, so that we are not a barrier to access to care for a family or child. If they come to seek services or they come to us for help and they are judged, or there is some of that stigma, they're less likely to come back, and we've lost an opportunity to help keep our family together. So it's very important, and we take that very seriously where we work.
And one more thing, too, I want to mention, since we're talking about getting in touch with those who can help for your family, West Virginia has easy ways to do that.
We do, and I want to remind everybody you can call 988. Easy to remember, just like 911. Call 988 if you're having a mental health crisis, and you can also call the non-emergency number, which is 844-HELP-FOR-WV.
All right. Ladies, thanks so much. We appreciate your time.
Thank you.
All right, thanks, Jennifer, and to our panelists there. And it's not just younger kids that deal with mental health issues. Some U.S. college students say that they're having trouble coping with their class loads. A Gallup and Lamina Foundation study found that 12,000 students are still working on their undergraduate degree. And they found that 2 out of every 5 undergraduates say that they have emotional stress issues. And more than 40,000 of those who participated say that they thought about dropping out of school. Researchers also say that the number of college students who say they suffer from anxiety and depression has been on the rise for years. It's been increasing since the start of the pandemic.
It has, Anthony. And at Marshall University, the Counseling Center is helping students every day. They're providing top-notch services not seen on many other college campuses. And they're also going above that high bar they already set, taking their work and focus further to include student athletes. I found out how they do it and asked about the most common issues college students are facing today. Heading off to class on the campus of Marshall University. It's a quiet and peaceful setting. College can be a daunting, emotional time, learning to juggle a new life away from home.
It can be really stressful for college students, not having a sort of guidance. You're by yourself, really.
Freshman Hayden McLeod is like the thousands of other students navigating a new world. And more students than ever are reaching out for help when they hit a rough patch. At Marshall this year, the Counseling Center, located in the heart of campus, welcomed 1,400 students in for services, showing an upward trend since 2016 for them. And a nationwide survey by Timely MD shows 7 out of 10 college students are experiencing stress, anxiety, and/or depression. Candace Lane is the director of the Marshall Counseling Center and says their numbers mirror the national trends.
Nationally, you're going to see the trends going to be the highest things, or the most things that student concerns are include stress, anxiety, and depression. And that is the same here. If we ran our data, it would show the top 3 concerns would be stress, anxiety, and depression.
And she says there's a reason this age group needs to ask for help, and there are proven ways to approach their needs.
Their brain is still growing, becoming more sophisticated. They're learning life skills. They're learning how to adapt and transition into adulthood and navigate college. So there's a lot going on with a young adult and an adolescent that's here on campus. We hear wraparound approach a lot with youth, but we provide that here at Marshall. We engage with coaches, we engage with advisors, we engage with professors. We really have a wraparound approach here to make sure students are surrounded with support. And if students can, use resources and work through mental health concerns, then we know that research shows that that's going to help them academically.
It's working with Marshall's student athletes, too. Olivia Woody is a case manager for the Be Heard Mental Wellness and Performance Program.
Sometimes we do team building, things like that, to let them know that, hey, you're not the only one going through this.
The university is leading the way for for athlete care, offering specially scheduled meeting times or quiet spaces for students who balance their academics with a busy athletic schedule. The nuance of their college experience is challenging in a different way. They first deal with the pressure of change from high school standout to being on a team where everyone is a remarkable athlete.
They might not be that starter. They might not get those high marks in the passing, the shooting percentage, the batting percentage, the goal percentage that they used to. And they also have to, again, navigate being away from home. We know now that if our mind is not where it needs to be, our body is not going to be where it is either.
Overall, banishing the stigma around seeking mental health help has been a positive move.
We try to open the conversation. We try to have fun events that surround mental health, and we try to encourage students to reach out and talk about it.
So from student athletes to academic all-stars, when the stress of college life builds up, the students at Marshall know they have a place to turn if they need it.
I'm honestly thinking about coming here to talk to someone about, trying to de-stress a little bit, but yeah.
We have learned so much today. We'd like to thank you for joining us on our town hall on mental health.
And remember, you can learn more about resources and support groups in your area by going to sinclaircares.com or by scanning the QR code right there on your screen.
We hope this gave you more options to make your mental health better.